Now, the United States Agency for International Development, US AID, which manages tens of billions of dollars worth of US foreign aid programs, is due to close on Friday. Employees will be locked out of their offices and computer systems. Several senior figures in the agency were placed on leave as the Trump administration took steps to fold its functions into the Department of State. US AID is by far the largest humanitarian and development arm of the US government, with a workforce of approximately 10,000 people worldwide and an annual budget of tens of billions of dollars. US Secretary of State Marco Rubio says the agency lacks transparency, hence the need for reforms. Another global body affected by the cut in US aid is the World Health Organization. The withdrawal of the of US from the World Health Organization is one of the key executive orders issued by President Trump on his first day back into the Oval Office, suspending funding and recalling all US personnel working with the institution. So how big an impact will this have on global health? Joy News Research has been crunching the numbers, analyzing data, and joining us now with details is our lead data and research analyst, Kofi Agyei. Kofi, what does the data tell us?
Kojo, US is big, and that's why when US coughs, grants and aid will definitely catch a cold. We are talking about a country that in 2022 gave away some $15.7 billion in terms of grants and aid. Now, let's focus on the WHO that the US says that they are withdrawing. This is not the first time. We understand the first time was actually in July or somewhere during the COVID period, 2020, when Donald Trump said that, look, they were not happy with the way the WHO were expending during the COVID period and giving some preferential treatment to China and putting focus on China. So they were withdrawing. But we know that that decision was reversed by Joe Biden when he came to power in January 2021. This year, another threat has been issued, an executive order in that respect, saying that the U.S. for the second time will be deciding to withdraw from the WHO. Now, the WHO is already out with the 2024-2025 budget, and that's what you can see on the smart wall. What is this figure? $6.7 billion is what they are looking to expend.
$6.9
billion. Roughly somewhere, let's say $6.7 billion is what they are looking to expend in 2024 and 2025, two-year budget. Roughly, if you look at the WHO, they spend between $2 to $3 billion every year. Now, this money is huge. They don't generate it by themselves. This is where they expect that money to come from. So let's look at the big pie. And you can see the red area will be occupied by the US. They are supposed to contribute 14%. And the Bill Gates and Melinda Gates Foundation will contribute 10% to this. That's huge. That's just a foundation contributing 10% to WHO's funding. The 8% is supposed to come from Gavi, the Vaccine Alliance. And you can see World Bank 5%, Germany 5%, United Kingdom 3%, Canada 2%, European Investment Bank somewhere 2%. So this is the pie. And definitely the one in red is the big component. So big that if you value it, $988 million is what the U.S. is expected to
almost contribute. $1 billion.
Almost $1 billion, you put it right. This figure is very huge. And if the U.S. is pulling out, they're pulling out with this big money on the smart wall. Now, beyond that, one key aspect that will be affected will be health. So let's break it down. This $988 million that the U.S. the WHO was expecting from the U.S. If you look at it on the health perspective, they were expecting that the U.S. will bring $235 million for emergency operations and appeals. This is health. Now, polio eradication, $133 million. You also have health emergencies, $154 million. HIV, hepatitis, and STI, $41 million. Tuberculosis, $29 million, and immunization, $16+ million. So just look at it on the perspective of health. Huge losses to WHO if the US decides to pull out. We already understand that WHO is talking to other countries that, look, convince the US to rescind their decision. You can see it there, and you can see that US is the big guy when it comes to the contribution. The pie we saw for you in valuation terms, this is what you can see. Bill Gates and his foundation, $724 million contribution. Mind you, this is also an American foundation.
Yes,
So we definitely don't know if this executive order will just affect government, or maybe they will compel other, private and citizens to also follow suit. We understand that U.S. will be big, and pulling out will have a big impact. Now we come down to Ghana.
Localizing the impact.
Absolutely. Now let's look at the US AID, or the US aid, and how much Ghana expects or gets from this source or this pool every year. Average is $150 million, and we use to support these areas that you see on the smart wall. This year we placed a request for nearly $138 million. Now we are crying over this. Countries like Nigeria won't be getting somewhere $1 billion. Ethiopia, $1 billion. And other African countries will also not be getting. They are the big guys who get more from the US AID. Ghana, this is still big, looking at the fact that, the pool will affect us, and already we've seen what's happening in the northern region. Now, let's break down this $137 million. We understand that healthcare will be the big part. $69 million or $69.2 million will go into healthcare. Education will follow with some $15 million. And if you come to agriculture, $33 million and all of that. So that tells you that this money is important. And if the USAID, which we understand currently, their website isn't even operationalizing or isn't working as it used to be, should tell you that Trump is serious and he wants this money back in the US. Good.
Quite interesting data there, and the sort of impact this will have on Ghana. And if you extrapolate it to the whole continent, it gives you a picture of how dire the situation will be. But